to do is try to get a real debate going on what private healthcare system or private healthcare delivery is and what it isn't. And I think that the value of introducing this bill puts every bit of ideas that we've talked about in the department for a number of years, and we're asking groups, organizations, colleges to come back and provide us with their thoughts and see how we can either incorporate them or not. But Mr. Chair, I think what it really stands to today is that the system is wide open. The system has no way of ensuring that if you're going, let's say, for an uninsured service like plastic surgery, we have no way as government to ensure that the facility is meeting guidelines. So what we're trying to do with this bill, is provide a mechanism in which to license the facilities that we do have today that are offering insured services, or uninsured services, I apologize, but also looking at the opportunity, if one presents itself, through contract with the DHA, to offer some insured services as well. We do not see ourselves investing taxpayers' dollars into the creation of a private healthcare service, but what we are doing is trying to ensure that the patient or that Nova Scotians receive the services that they require. And and I think the discussion is an important one. The member opposite brings up the issue of human resources and exactly where they're going to come from. What we've seen from a couple of the experiences we have here in the province now is that we're finding some late career professionals, whether they be nurses or otherwise, that were retiring anyway, that they have an extension of their careers now and able to continue to contribute to Nova Scotia's healthcare. What we're seeing is an opportunity for other physicians to stay in this province. You know, if we look at the total number of physicians coming to the province today, we have a net gain of 46. Why are physicians leaving? Where we probably brought in, I think I'm just looking at the total here. Total recruited was 105. Total retained, I think, was about 46 out of that 105. So why are those physicians staying? And I think it really has to do with a couple of opportunities that they don't have here in this province. One is academic freedom and being able to do research and those kinds of things, and another way to provide health services in an entrepreneurial manner, which I think is what a private delivery might be able to provide. So, again, we are debating the merits of a bill when we're really supposed to be discussing the contents of my budget. But I again thank the member opposite for bringing this issue forward, and to understand the importance and the complexity of what we're talking about and what we are really talking about and what we're not. And it's a discussion I know is worthy of many hours of discussion, but I look forward to that when the bill gets called again in this legislature.
Thank you. The honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman. And that's what I'm doing. I'm trying to paint the picture of what the government is attempting to do or where they might be going in the future. And when we see that healthcare is the #1 issue for Nova Scotians, then when I see a budget from this government that actually doesn't provide the funding that has been what we've seen in the past, the Minister of Finance, the Minister of Health have both stated that we've seen a constant about 8% increase over the last decade or so. So when I look at a budget and I see a health spending capped at 5.3%, then that leaves the question of where are we going? Where is this government going? And that's why I wanted to mention the privatization of healthcare, and it was actually the Minister of Health who mentioned Bill 126, not myself. But it's not just the Minister of Health, it's the Minister of Finance who, in a recent news, was reported in the New Glasgow Evening News on March 9th of 2007 that, he said that tighter finance financing of healthcare is important and is required by the Conservative government, and that they'll be looking at creative solutions, including private healthcare delivery within the public system. But he wouldn't offer any details when he made those comments. So I know the Minister of Health has been quoted several times on this over the last year or so since he became Minister of Health. And I'll again quote another piece that was on CBC radio, I believe, where the minister had stated that he wanted to do more consultation. I think he stated it in this House also in November with Nova Scotians to find out what their thoughts are on privatization of healthcare or private healthcare in the province. So I'd like to ask the minister, has he gone out and talked to Nova Scotians about their thoughts and concerns around privatization of healthcare and issues revolving delivery of healthcare here in the province?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And, you know, Mr. Chair, there's been a lot of consultation going on since the introduction of this bill. There was a lot of consultation that went on prior to the introduction of this bill. And I can say that over the last number of months, we've had the opportunity to do more directed consultation, meeting with the people that will be directly impacted by this, which is really the colleges, the nurses, the physicians, and Docs Nova Scotia, as well as different organizations, DHA boards, DHA chairs, DHA CEOs, and you know, there's been a whole bunch of that going on. At the same time, we've had the availability on the website for anyone to write in with their thoughts. I've got to say we haven't got a ton of those, even though I think we should maybe advertise it just a little bit more, that there's the opportunity for Nova Scotians to input. But what I would also ask them to do is look at the bill, look at the things that are contained in that bill, to look at, I believe there's a white paper that accompanies it, to give broader context to the things that we're talking about. And I think what we'll try to do over the next, again, number of months is to continue that process. I envision also maybe taking some of those stakeholders and getting them all together around one table, and you know, not only have the department try to stand up for each group, but have each other to stand up for each group to see if they can come up with some kind of compromise in this issue as well. Because at this point, and I will say it again, the system is wide open. It is completely wide open. There is no, in my estimation, guarantee of safety for the patient. I know when you talk to the professionals that do have these facilities today, they do adhere to very stringent guidelines and accreditations. But how do I, as a health minister, you know, guarantee that to Nova Scotians that they are going to be getting that quality of service, that level of safety? I can't, because there is nothing that gives me the mandate to do that. And I think that is probably, the most important part of our bill. And I think what we're going to continue to do is consult over the next number of months, and then finally bring it in here with the stuff we've heard and bring it to the floor of this legislature. Again, it is wide open at this point, and we want to find a way to contain it as well, and see if there are benefits to the Nova Scotia health system.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman. And the one thing with the minister's comments was that the one thing that I didn't hear, or maybe he didn't say it, or he might say it after I asked him, was about the public. The quote that I read earlier from CBC was that the minister himself wanted to get out and hear from the public. So has the minister himself gone out to the public, to the taxpayers of this province who are going to fund, or whose money is going to go towards, possibly going towards private delivery? Has he talked to the public? Yes, I understand there's interest groups, and I commend them if they've started that, because that's what I think has lacked over the last decade or more in healthcare, is that those who deliver the service are the last ones to be consulted. I know, Mr. Chairman, from being a paramedic, from working with other healthcare providers, that they are the last people to be acknowledged and request of information of how things should change. So I'd like to ask Minister again, has he himself attended a meeting with the public, or is he going to attend a meeting within the public? Are we going to see him travel this province, which I think for an issue like this, he needs to, and to allow the public, those people who are going to be paying for this, for the healthcare service, time to come and talk to him and give their opinion on that.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I can assure the member opposite that this issue is brought to my attention on a regular basis as Health Minister from regular Nova Scotians, people that are concerned about their health care, that are concerned about their wait times, and are looking to us for creative solutions. And I can say that we have had the opportunity to meet with groups. Those groups represent as well regular Nova Scotians. We have met with union representatives, and those union representatives represent frontline healthcare workers. I think that over the next number of months, the opportunity for every Nova Scotian is to put their ideas on paper and get it into the Department of Health through our website. And again, every opportunity that I have as Health Minister to get out and present to Nova Scotians and groups, I will continue to ask questions and take the input from them as we go forward with this issue. But Mr. Speaker, or Mr. Chair, again, we will continue along this path to ensure that the patient is number one when it comes to the healthcare system in Nova Scotia.
Thank you. The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Chairman, and I would agree. I mean, I come from a profession that's entrenched in our training and our thoughts and our actions within the healthcare system and the delivery of emergency health services in the province. So I would like to ask the Minister on, he's saying that they're compiling this information, that the public has a chance to go online, make submissions to government. So I would like to ask him what his intentions are when he gets this information. He mentioned coming to the floor of this legislature, but I know he talked about Bill 126 and that dealing with private facilities, but what does he envision bringing back to the floor of this legislature when it comes to private health care and what he composes with the results of what input he's gotten on this issue? Like, is there a timeline, and what is his intentions on when he compiles that information? Are we going to see other pieces of legislation like Bill 126? So timeline and what his visions are for possible future legislation on this.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And what we continue to try to do is make sure that we have a publicly defined system and a publicly funded system to make sure that all Nova Scotians receive the services that they do require. Throughout this process, I think what we're trying to do is that Bill 126 is designed to be a place marker, I guess is what you really could call it. Getting the information to Nova Scotians of what we envision or what we think should be in licensing private facilities or what private facilities should look like. I think the next steps throughout this consultation process, as Nova Scotians have the opportunity to input, is that we've got a couple of ways we can address this. If we feel, as I feel and Cabinet feels and the Department feels, that we want to continue with Bill 126, we will bring it to the floor, continue its discussion to the floor of the legislature. We will talk about the changes that we might want to see to the bill. We will present them in the Law Amendments Committee. If we feel that the bill does not address the direction that we're getting from Nova Scotians, we will draft a new bill to be introduced at another time. But Mr. Chair, I think what the importance of what we're trying to do is trying to have a good discussion to let the public know what we're trying to do and what we're not trying to do, and then have that true discussion with Nova Scotians. And I think, so far, our discussions have been really good. They have addressed certain of our issues and concerns that we might have had. There are still concerns there by some of the groups that we're trying to find ways to incorporate those, and either through an amendment or further clarification, or whether they be designed in a future piece of regulation that would accompany that bill. There are a lot of avenues for us to go down in the future, and I will ensure and make sure that the information that we receive from Nova Scotians are incorporated the best way possible in either Bill 126 or in a future revision of that bill in the future.
Thank you. The honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman. So that'll bring me to the next few questions I have, and that's around the issue of the Corpus Sanchez report that was commissioned or was tendered, I believe, just prior to the last election or just after the last election. We know that the government spent over $1 million to have this report prepared. So I'd like to ask the Minister of Health, has the Corpus Sanchez report been finalized?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member. The facilities review, or the FZOR as we call it at the department. I don't know if we thought up that acronym, but I can tell you the Department of Health is full of acronyms. Well, I'm glad they're acronyms because sometimes the words are way too long. But ultimately, what we're really trying to do there is really have a true financial and systematic look at how our healthcare system is performing. We envision to have a final report come to the department, or a final draft, or whatever the heck they want to call it, somewhere towards the end of April into May, where we can have a base idea of where we should be going. I know the members opposite, I know the Leader of the Opposition has mentioned on a number of occasions that we need to have a full strategy on healthcare in the province. And I think what we really needed first was a true analysis of where our funds were going, how they were being spent, what kind of programs we needed to make sure that we have the correct healthcare teams in place. You know, there is a lot of detail that has been put together over the last number of months. We did envision to have the report available a lot sooner, but of course a number of factors such as negotiations, unplanned delays, and again the report we're hoping to have in place by the end of April, 1st of May of this year, and then we can look at those recommendations and see how we can implement them through the business planning process through next year.
Thank you. The honourable member for Sackville-Cobequid.
I'd like to just ask the Minister, when was the proposed final date for the report to go to government if it's delayed now? What was the original time of completion for this report?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. I think we're looking at about, it was a 6-month extension, so it would have been, I think, available, I think, sometimes in December or November of last year. What we did find as the consultants went from district to district to review the operations, they found that further detail was required. I know that the districts have been, the site visits included over 40 hospitals. They have reviewed all provincial programs, which is a lot of work. But I think what this will give us is a really good picture of what our healthcare system is doing today, what kind of expenditures are really happening out in the districts, but also come with recommendations on how to better deliver safe healthcare in this province, to better use the HHR that we have today, and to identify those programs and services that can be best managed on a system-wide basis. What else? And try to inform the development of a strategy that will improve the health delivery system here in Nova Scotia.
Thank you. The honourable member for Sackville-Cobequid.
So so what maybe I'll do is a couple questions. 6 months extension. So one of my questions would be, what is the added cost to government, to taxpayers for that extension? And what were the instructions that government gave to Corpus Sanchez when they were looking at this review? Was it wide open? Were they instructed to look at just public system or the private system? Are they looking at every aspect of delivery of health care that's out there, both privately and publicly?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I can categorically say no, that private healthcare was not part of their mandate. If we look at, we expected a number of outcomes as they started their process. We had to look at the confirmation that resources managed by DHAs and IWK are allocated appropriately, because we always have a discussion, it seems, during business planning with the districts on who should be getting more money and whether their programs are funded correctly and those kinds of discussions. So we wanted to have a better feeling of that. We wanted to have an identification of opportunities to improve system access and efficiency. We wanted to identification of program services best managed on a system-wide basis, informing the development of a strategy to improve healthcare delivery system, and the cost of the review identified savings to be reinvested back into the healthcare system. And really to the first question, the extension, I believe, was $50,000. There's an added, I think it's called an ER investigation that cost another $50,000. So it's about $100,000 extra for that extra 6 months that they're investigating the process in Nova Scotia.
Thank you. The honourable member for Sackville-Cobequid.
Now, was this delay, I know the member or the minister mentioned a few things earlier, was this the delay of the departments they were looking at or government, or was this a delay on the part of the companies, Corpus Sanchez, for them to require a 6-month extension?
Thank you. The Honourable Minister of Health.
Thank you very much. To the extension, really, the extension was offered because as the consultants got down into the system and started the discussions with the district health authorities make up about 20% of our provincial budget, so it was very worthwhile to go in and see how those operations were working. There were sets of data that were required that took some time to get, and what we've been doing over the last number of months now is verifying the data with the DHAs. Data came back. We've applied or the consultants have applied some information to it to look at those efficiencies and those questions that we've asked. And what we've done, what they've done, I keep saying we, but they have done is try to go back to the DHAs now to validate the information that they've had to make sure that the DHAs are comfortable with the information that's going to be presented as a part of this this report. We need to make sure, we want to make sure that an agreement with the DHAs so that, we want the DHAs to be as a bigger part of this process as they possibly can be, because they are the service delivery people for Nova Scotians. So we need to have, absolute buy-in from them if we're looking at some province-wide changes, whether what program it comes from. So everybody has to be on board on this one, and that did take some extra time. But for the most part, it was really a lot of data mining that was required and a lot of work on the DHA levels to provide that and to verify it.
Thank you. The honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman. And I believe from, if I recall, from my readings of the schedule for Corpus Sanchez, that they were doing it in sections, and that they'd evaluate a certain area, and then they'll go on to another one, go on to another one. Is that the case? And if it is, has your department received the reports of the individual or the areas that they were looking at, or are they going to just give you all the information at once? And if they have given you the information now, is your department looking at it and going through it now?
Thank you. The Honourable Minister of Health.
Thank you very much. We look at this report to be sort of in two parts. One of them will be a main report to the Department of Health that will include a number of recommendations on the fair funding of DHAs, the sharing of programs, the funding of provincial-wide programs. It will also have a component of reports to each DHA. So each DHA will have an in-depth analysis of how they're spending their money, of the services that they have within those districts, of their staffing models, and in a view of having some recommendations to help them provide better care to patients. So it's really a two-level report, one to us and the second step to each DHA, so that they have a better feeling of what they're doing.
Thank you. The honourable member for Sackville-Cobequid.
So just so I can get it clear in my mind, so the DHAs will, each DHA or section of that was evaluated will receive a report. Now, is that all at the same time, or have those DHAs received that report now and are looking at what that report entails?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and again to the member of Sackville-Cobequid. The issue that each DHA was reviewed, and all their programs were reviewed, I believe, and they will be receiving a report. And actually, right now, I think they've had some components of that, so they're actually looking at their numbers and validating the information as it's being presented. That will be finalized. It will be contained in a province-wide report to the department, to government. Also within the main report, I believe, will be a number of recommendations on private province-wide programs as well as we offer to Nova Scotians. So I know the consultants are still busy out in some of the districts and still visiting some facilities to validate those numbers. And I can say this has been a very comprehensive program, and I know they've done probably more work than we would have expected of them. But I think the information that'll be important to the information that will be provided, so that it can be a basis of moving further to improve health care to Nova Scotians.
Thank you. The honourable member for Sackville-Cobequid.
So I'll look forward to that report, and hopefully, by the next sitting of this legislature, if the budget passes and we're back here in the fall. And I truly look forward to it, because that is an area I think that may show what your intentions are when it comes to delivery of health care here in this province. So now I'd like to turn to the retention, recruitment of physicians and other healthcare providers. We know that it's a huge issue here in the province. I've said it earlier around my feelings around opening up more privatized clinics, that it would erode the public system of just those individuals, the healthcare providers. So one of the things I've advocated on many times in the House here is the use of nurse practitioners. We know several years ago there was an initiative to hopefully entice some of those more senior veterans of nursing. And what I mean by senior veterans of nursing is those highly skilled nurses that have been working in the system for many years to go on and upgrade their education to become nurse practitioners. And we all know that nurse practitioners can, I think, play a huge, huge role in delivery of healthcare here in this province, and not only on floors in the QE2 or down in Colchester Regional, or down in Sydney. They can play a role especially in some of our rural communities, and we know how important they work with the community, especially around their scope of practice and what their abilities are. So I know the government's initial initiative when they tried to attract or increase the number of nurse practitioners in this province, they allowed them to go to school, to upgrade, become licensed nurse practitioners here in this province. But then it seems to fizzle out then, Mr. Chairman. It seemed that the opportunities for nurse practitioners are limited here in the province. And I know the minister will probably mention a few of the locations that they've worked on over the last couple of years, but I think they've underestimated the importance of these professionals in the province of Nova Scotia and where we can utilize them. So my question to the minister, why are we underutilizing our nurse practitioners here in the province of Nova Scotia?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. I think this year's budget talks about, I'm just looking at my CFO for what he can find in here. I think looking at 25 nurse practitioners in the province as a result of this budget. I think prior to that there were 19, so we're looking at a an increase of 6. I know it doesn't seem like a lot, but ultimately it's to place these professionals in places where they can work with rural communities, where they can work with communities. You know, if you look at the training of a nurse practitioner, and if you look at the effectiveness, and I just have to go with the experience of the member for Digby Annapolis, and he talks about his nurse practitioner. And he calls it his nurse practitioner, but I think it's his whole community's nurse practitioner in Briar Island. And what they've been able to provide is really a level of service that hasn't been seen for many, many years. And what the nurse practitioner really does, I think, in the Briar Island context, is they get out to households, they visit, and they have more of a wellness mandate, where they want to make sure that the community is living well, to make sure that they can sort of prevent anything adverse happening to their patients. So I think it's working really, really well, and that's because I know the member for Digby Annapolis speaks about it, you know, quite proudly of the work, and is looking for some expansion to that. If we look at the use of nurse practitioners in the province and current breakdowns, DHA 1, South Shore has 2, DHA 2, Southwest has 2, DHA 3, which is Annapolis Valley, has 3, DHA 4, which is Colchester, has 1, DHA 5, which is Cumberland, has 4, DHA 6, which is New Glasgow, has 2, DHA 7, which is Antigonish, or Gasha, which is the Strait, has 2, DHA 8, which is Cape Breton, has 3, and DHA 9 has 2. So we're trying to evenly distribute those professionals across our system. The other issue that that the member opposite has brought forward is using them maybe in different settings, and using them in particular to try to address some of our ER shortages in the province. The issue with that, and the difficulty we're going to have with that, is that they have to work in concert with a physician. Okay, there has to be a physician somewheres, just in case. I mean, most times it's just in case, because I do feel that these professionals have wonderful training and make some great decisions. But you know, just in some of those specific cases, they need to have that collaboration. And you know, I can go back to Digby, because it's the one that the member from Digby Annapolis speaks to me on a regular occasion, is maybe staffing the ER with a nurse practitioner on those days that it's off. But the problem was, in the first place, is that we couldn't find a physician to work there, and the added problem is that we wouldn't be able to find a physician to back up that nurse practitioner if they were doing some emergency medicine at a facility. So this year we continued our expansion to nurse practitioners in the province, providing I think it's a $1.2 million additional to continue to expand our complement of nurse practitioners in the province, and we'll continue to work on it. If you know what the bill that we did pass forward, the Registered Nurses Act that passed in this legislature, I believe in the fall, did expand not the responsibilities, but the scope of practice for these professionals, give them some more responsibility to. Well, I thank the member opposite for filling in that word, because he knew I was having trouble with it. I find sometimes as an Acadian, I'm thinking of French words, and I know they don't necessarily go so well on the floor of this legislature, which I know has happened to me in a couple of occasions. So I want to thank him for filling in on that scope of practice issue. I know I got into some real trouble when I did use another word one day that I'll probably never ever use again. No, you can stay away from what I used. But anyway, you put it in context of why I said it. But anyway, again, $1.2 million more for additional nurse practitioners, and we'll continue our investment in that manner.
Thank you. The honourable member for Sackville-Cobequid.
And I think the minister hits it right on the head when it comes to what we need to see here in the province, and it's dealing with scope of practice for healthcare providers. We've just increased, I know through legislation, LPN's scope of practice, which, as I stated, that they accept and they want to see. And I think it's important that we recognize that we need to look at all professions especially in healthcare, on where we can expand that. The member or the minister mentioned Briar Island, the nurse practitioner that's there. She does a great job, and I think the community is well served by that individual being there. We have other examples where scope of practice or an increased scope of practice has benefited the residents. We look at Tancook Island and some of the paramedics in that area that have an expanded scope of practice who deliver a service that is important and needed, especially in the rural communities, those remote areas here in the province. And I think that's important. But I have to remind this minister and the government that they haven't been treating, I think, the nurse practitioners as a profession, or haven't been giving them the opportunity to make that profession thrive, or that designation of as a nurse practitioner, Mr. Speaker. And I've given this example in the House before, and I'll give it again. I come from an area where we have the Cobequid Community Health Center, where we had one of these nurses who took it upon herself to go back to school to upgrade to the level of a nurse practitioner, but she was unable to get a position here in the province. They were limited. And part of the problem they're finding now is that they can't do enough practicum or enough time to keep their scope of practice and their qualifications, thank you, their qualifications to the level that they need to keep that status as a nurse practitioner. And that was one of the problems with this individual that I mentioned, that she couldn't find an area that would accept her so that she can keep those qualifications, that potentially down the road that we could use her as an important component of healthcare and the healthcare service here in the province. And I have to regrettably say, Mr. Chairman, that this nurse is now working in Moncton, at the Moncton Hospital, in the emergency department. The one thing that she wanted, and I tried, and I've asked the former Minister of Health, I've asked the former Premier several times in this House around the use of nurse practitioners in our emergency rooms, which I think, and we don't have to just look at rural communities. We have crisis here in HRM and in Sydney with the long waits. A perfect example is the Cobequid Centre. Here we have a facility that is not open 24 hours, but has many services provided there. And one is an emergency department that's open from 7 in the morning till 10 at night. But with her shifts there, she was unable to work, and I think it refers a little bit back to the requirement of a physician. She was unable to work to her full potential. So here is an individual, here's a nurse who is actually working in triage in the Cobequid Centre, who could actually divert, I would say, conservatively, 30, 40, maybe even 50% of the individuals who go to that emergency department from having to see a physician. That's a huge number. And you don't have to take my word for it. There's many studies out there, I've read them in the past, where the number of patients that can be diverted or be treated by nurse practitioners is huge. And I think that would go a long way with reducing some of those stresses and some of the pressures on the emergency room, on the number of patients requiring admissions to hospitals. So I'd like to ask the minister if he's aware of a limitation of what physicians in this province can oversee or overlook nurse practitioners. From my understanding, an emergency room physician, for example, an ERP, cannot have a nurse practitioner working under them, under him or her, and it has to be a general practitioner. So I'm wondering if the minister would know, or maybe the deputy minister could advise them if that is actually a current policy, that an emergency room physician cannot have a nurse practitioner working under them because of regulations or policies or rules of healthcare here in the province.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, there is no policy in regards to the utilization of nurse practitioners under an emergency room physician. We are developing at this point a policy to have that happen. What we've been trying to do at this point is utilize a nurse practitioner as a primary health care provider, so community-based, trying to do the things that I feel are extremely important, which is population health based, having better outcomes for lifestyle and those kinds of things. So we actually slow down the visits to ERs and in other instances. But the member opposite also underlines a bit of the issue, I think, and the challenge that we've had in bringing nurse practitioners into our system. And I think it's going to be kind of the same issue that we have in bringing LPNs into full scopes into certain settings, that we're going to have in utilizing, looking for the word, birthing, the... Midwife. There you go, midwife. That midwives are going to have and integrating into our healthcare system. It's funny how you have a brain episode like that. Somebody can't come up with the right word. But ultimately, as these professionals work in our system, and the other professionals become comfortable with them, their scopes tend to, they tend to start working to their full scope. And I think that's been the challenge up to now, is where physicians, and I'm not going to pick a fight with physicians at this point, but ultimately, they have been slow to the mark of wanting nurse practitioners to be sort of in their domain. But I think what it is now, they're realizing the importance of those individuals and are actually including them in primary health care teams, knowing that, if there's a nurse practitioner working with you, that they can do this stuff, I can do this stuff, and we can see that many more patients and impact communities even better. And I think that'll happen with midwives as well, as midwives come online, hopefully in the fall, moving into winter, how they will be integrated into the current system, how they will be utilized, and how they will be regarded by nurses, how they will be regarded by physicians, and how they'll be used as a part of that very important primary health care team, or in this case, birthing team. Just to conclude, so my comments on this one is still to continue the progress that we're doing with, primary health care nurse practitioners, but also to expand the utilization within districts, to come up with that policy of how they work under an ER doc, and how we could use them in cardiac care settings, how we could use their expertise in emergency rooms and other places where we do need extra help within our healthcare system.
Thank you. The honourable member has approximately 40 seconds left.
40 seconds.
That's
okay. I think hopefully I made my point to the minister and maybe to the deputy, the importance of looking at nurse practitioner. I think, if the government is committed to it and they help and assist nurses and those who might be thinking about going to upgrade, it would go a long way. I think the government missed the mark years ago after the initial program to help educate the nurse practitioners, and we lost several of them because of, after that initial support, government wasn't there to get them through those growing pains.
Order, please. The honourable member's time has expired. The honourable member for Glace Bay has approximately 45 minutes.
Thank you, Mr. Chair. Good to be back, Mr. Minister. Good to see you still here. I always appreciate following the member for Sackville-Cobequid. There's just something about that guy I like. I don't know what it is. Mr. Speaker, Mr. Chair, let's continue on with some questioning for the minister. And when I finished my questioning earlier, Mr. Minister, we had just broached the subject of emergency room and closures and so on, and certainly the problem is not going away. The problem is as recent as today at the Northside General. Today in Cape Breton, there's a closure of that emergency room tonight. The emergency room won't open again until tomorrow morning, so it's an ongoing problem, and that's an example of it. We can't ignore the fact that the ERs across the province are closing on a frequent basis, and I guess people are left wondering whether is it a lack of doctors, is it a lack of staff to maintain basic hours of operation, and I think everybody will be in general agreement that it's time to address the issue of ER closures. We've seen those ER closures mounting over the years. And as a matter of fact, if we look back the last several years, we're looking at almost 5,000 hours of closures. That's almost 7 months of closures. So, Mr. Minister, my question would be, and perhaps a detailed answer may be in order if you can, Mr. Minister, what is this government's plan to try and stop this rather alarming trend of ER closures in this province?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I had mentioned, I think in my last hour with the member opposite, the member for Glace Bay, and I know this is a very important issue for him as the member for Glace Bay, and the Glace Bay Hospital has been experiencing a number of closures over the last number of years. And Mr. Chair, I can say that you know, we've done a fair amount of recruiting around the province. We over the last 18 months, we've seen an increase of 188 docs, but if you also look at our retention rate, you know, it's not as stellar, but we have a net gain of about 64 physicians across the province on a yearly basis. This is a challenge that we're having right across our system from a Canadian context. And a lot of time, it really has to do with a physician's expectation of lifestyle. That they do want to have the opportunity to take vacations and spend some time with their families as well. You know, if we look at the closures in the province, and maybe I'll give a listing for the, you know, for the record, that District 1 has been open 99.8% of the time. DHA 2, which has three ERs, has a total of 97% opening. So Digby, of course, being the problem. Digby is closed or is open. Okay, the 97% of the closed hours, or 81% of that closed hour, has to do with Digby and Shelburne. DHA 3, 99.7% open. It has a little bit of issue sometimes with Middleton. DHA 4 is open about 94% of the time, or 94.2. Their issue, of course, is Tatamagouche. DHA 5 is open 98%, which is Pugwash is the issue sometimes. DHA 6, wow, 100% of the time they're open. DHA 7 is open 99.8% of the time. Their issue sometimes is Port Hawkesbury is closed. DHA 8 with 8 ERs is open 96.9% of the time. Glace Bay is 46% of those closed hours. New Waterford 25%, North Sydney 29%. So the smaller hospitals compared to the regional do close on occasions. DHA 9 is 100%, IWK is 100%, so the two main tertiary care emergency rooms in the province are open all the time. Actually, that's Alan's, so I'll just pass that over to him. What we really need to do as well is to continue to work with the DHAs and to try to speculate, I guess is the best word, or try to envision when those closures might happen. Because I think part of the problem is we're finding out too late that a closure is going to happen, or that a physician has to go for, whether it be upgrading, whether it be family time or whatever, that we're too late in getting the locum program into place and getting a replacement to work in that ER. And then in most cases, it's closed for a day. You know, it's very difficult to get someone to come spend time in another jurisdiction for a day. If it's a week, then sometimes we can an opportunity shows up that we can get someone to come and fill in. But what I can also say to the member opposite, when the member for Sackville-Cobequid was talking about Fazor and of course the extra time, and I talked about the extra time it's taking to complete the process, which was costing us $50,000. But I also talked about $50,000 for an ER evaluation. And what we've asked Corporate Sanchez to do as a part of Fazor is add an ER piece to help us develop an ER strategy that will help those communities have those emergency services. So I look forward to that report coming out, I believe sometimes in the end of April or beginning of April, to help, or the end of April, in order to help us decide on how we're going to address the issues of closures of ERs like the one in Glace Bay.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair, and it's interesting to hear the minister bring up the issue of planning, because that perhaps is one of the biggest problems that are being encountered in keeping ERs open, and whether or not, certainly no one would begrudge a physician a holiday or a day off with the number of hours that physicians put in this province, but if some of that planning, some of that foresight is there, then perhaps these closures could be totally avoided. No one's arguing that the ERs are open a good amount of the time. The amount of the closures, the number of closures have been mounting, and it's not. I guess it depends on whether or not you need an ER. And if you go there, if that emergency room is closed, then it wouldn't really matter to you whether or not it's been open 97% of the rest of the time. It only matters if it's closed on the day that you go there and you're no longer able to access that emergency room. Which brings me to a question, I guess, that why are so many people actually going to emergency rooms in the first place? And you know, I'm wondering if the government has bothered to ask that question. Perhaps it's because of a lack of family doctors. There are over almost 50,000 Nova Scotians who are still without a family doctor, and that number is growing on a daily basis. So perhaps the minister would outline exactly how he's going to address that problem, and if indeed it's connected, if the lack of family doctors is one of the reasons that our emergency rooms are actually bursting at the seams.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. As I've talked about in a number of answers to questions in this House over the last week or so, and prior to that, over the last 18 months, over 188 new doctors began working in Nova Scotia. Of course, we haven't retained all those 188, and you know, I wish we could find ways to, of course, keep those folks practicing in our province. But what we're also seeing is that there is a need, a trend for those physicians, of course, to try to situate themselves in more urban settings, looking for different opportunities for their families. So it makes it a challenge to get physicians to locate into places like Glace Bay, places like Digby, and other relatively rural areas of our province. At this point, if we take our total number of physicians in the province, Nova Scotia has more doctors per capita than anywhere in Canada. So how does that, you know, roll itself off into having so many ER closures? Recruitment numbers have been edging up over the last few successive years, so we are having more and more success in retaining these individuals. But we still have some challenges in certain of our ERs. I think what we also need to do, you know, vacancy rate's almost 2.4%, okay. You know, ultimately, we need to find a better way to entice these physicians to some of our needed areas, whether they be through incentive, whether they be through community work. You know, I talked to a lot of physicians in the last number of months, and you know, why do they go to certain areas? And it really has a lot to do with how the community accepts them, how they integrate into those communities, especially if we're talking about some of our international graduates that come here. You know, if you're from, for example, Pakistan, you know, we've had a few Pakistanis, and you know, we do take medical graduates from a lot of places around the world. You know, how do they integrate into a place like Digby, or how do they integrate into a place like Glace Bay? And I think we as communities have to do more work, and I know that through the CAP program, we've been addressing some of those issues when it comes to training of these specialists as they come to the province. But I think if you look at Yarmouth, they've had a good strategy going in trying to entice these physicians. I know Clare has had some results in the last number of months working with some individuals, and it's about community and making them feel as a part of it. When it comes to ERs, again, we really have to look at the effectiveness. And the last thing that I want to do as a health minister, and I know government doesn't want to do, is try to have ERs open that are unsafe. So we need to make sure that we have the correct teams in those facilities to offer the services that Nova Scotians expect. With that, I know within areas of the province we do have a phenomenal EHS system, and and ultimately I would want to keep people from an emergency standpoint going to where they are going to get the best service. But we have done, like I said, we've done a phenomenal job, I think, in the last 18 months of getting physicians come to rural areas. I think that we have to sort of maybe back off a little on our expectations of what physicians can do for us. I think there's a lot of common knowledge that has eroded over the last number of years of how to treat certain things. From a home standpoint of, I know when I had a fever, my mom gave me my Tylenol and said go lay down, or you used to do some things at home, and you don't see that as much anymore. And I know even from my experience, when your kid's got a fever of 101, and you don't think of some of these things. So what's the first thing you do? You're heading off to an emergency, or you're heading off to see a family physician for diagnosis, and all they're going to do is give you Tylenol and tell you to go home and lay down. So I think we need to re-educate the population on basically home medication and how to treat and how to take care of these particular ailments, and try to keep some of that load off of our ER. But at the same time, we know there's still going to be challenges as we go forward. I just talked a lot.
Thank you. The honourable member for Glace Bay.
Well, I know, Mr. Chair, that the minister knows that certainly those problems they're not going to solve themselves, and they're not going to go away. And you listed a number of them, including the fact that perhaps what we should be doing is looking at things such as foreign credential recognition legislation, perhaps in this legislature. We have doctors and health professionals coming in from other countries waiting much too long to have their credentials recognized. So are you considering moving ahead on that sort of issue?
Thank you. The Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, we have been working quite extensively with the College of Physicians and Surgeons over the last number of, I think, a year or 2 years now, on what would be qualified as the CAP program, or the another acronym that I'm not too sure what exactly the words are. But ultimately, through the CAP program, it's basically evaluating these foreign trained physicians to see what their capabilities are, to help them with the further training, so that they can have a full license here in the province. I can say that 2 of the cohorts assessed in 2005, 21 candidates were successful, and 16 of these individuals have been recruited to and are currently practicing in Nova Scotia. Of the cohort assessed in 2006, 9 candidates were successful, and 8 of these individuals have been recruited to Nova Scotia, 7 of whom are already practicing in the province. So there's sort of I would qualify it as almost a return for service for these individuals, that they get the further training here in Nova Scotia, that they can go into a community here in Nova Scotia and provide us with a service for a set period of time. And of course, what you hope is at the end of the day that they get integrated into those communities and feel that they should be staying. The other thing that we really need to do, beyond working with foreign trained doctors, which we can't necessarily depend on that stream forever, because really what we're doing, in some cases anyway, is stealing away some of these physicians from other areas of the world that probably need physicians as well. And I think that the concern that we have is...
Order, please. Order, please. Very difficult to hear the Honourable Minister.
Thank you very much, Mr. Chair. Good chair. I'm sort of losing my train of thought here. But ultimately, we're sort of a return for service from this individual. We don't want to be stealing them, of course, from other jurisdictions that so need the physicians as well. So we need to be conscious as well of the locally trained physicians as well. Those ones that are going through DALMED, that are going through other programs in Canada, such as actually the Francophone students that we have right now in Sherbrooke, the upcoming program that we'll be having in Moncton as well. You know, I think there's been success actually in Mr. Chair, in your riding, in the riding of Clare, where there is actually one or two or three of those people that are going to the Sherbrooke site that are looking for opportunity to come back to Clare, and they're not necessarily asking for more money or those kinds of things. What they want is a medical center that they can work collaboratively in. So it's, you know, sort of the old days of one physician seeing, you know, 6,000 patients is sort of gone, like I know Dr. D'Entremont has done on many occasions. And actually, I want to take my opportunity here to wish Lionel very well. Dr. D'Entremont has been having some health problems, and I know is going through a very trying time. And I know that the community of Clare is very concerned about their physician. This is one of the older type trained physician, and being a D'Entremont, I kind of know what his work ethic is like, and I think he saw somewhere close to 6,000 patients, you know, it's phenomenal. So it will take 2 or 3 other, you know, these new physicians in order to take up that kind of complement. But again, to the effectiveness of a community really working with its own to help them with their training, to get them back home, to provide them with the opportunity to practice medicine, I think has done really well. We really need some kind of program on a return for service, you know, for lack of another word for it, that if you are, and I don't know what the enticement of what we're going to pay for, but if we pay for a certain part of your training, and I know the Minister of Education has some great ideas as well on this one as she comes forward debating her budget, you know, to really help these physicians go through their training, which is very expensive, but get them to come back to Nova Scotia or stay in Nova Scotia and provide, let's say, 5 years in a community. And again, what you hope is that these people get very, very comfortable in their communities and end up staying. So, you know, there's a lot of initiatives going on. As I said, with the CAP, we continue to work with family physicians. You know, family practitioners, just as an example, in 06-07, there were 43 family physicians recruited to the province. So 17 left the province, so for a net gain of 26. So we do have 26 new family physicians practicing in various locations across Nova Scotia. And those are the kind of numbers I think that look good. We need to do a little better job. We need to find ways to entice them to go to places like Glace Bay in this instance, where I think one more physician would make a world of difference in keeping that emergency room and keeping that community that much more healthy.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. I agree with the minister that we're not where we used to be in terms of family physicians, and perhaps in some aspects, if we return to the days of family physicians that saw 4,000 or 5,000 plus patients per year, everybody would have a family doctor and everybody would have an ER that was open. The good old days, I guess, we'll have to refer to them as, because they don't exist any longer. I wanted to get back, and having said or asked the questions I want to ask on that subject, I want to get back to the catastrophic drug program, Mr. Minister, and in particular, there is no apparent money that's being put aside to fund catastrophic drugs, and with this province among the worst in the country for the number of high-cost, life-saving drugs that are being funded, it does seem, one would think, rather unfair and in some cases inhumane to prevent people from accessing the drugs that they need to simply survive, because they might live in the wrong Canadian province because we don't fund that particular drug. So I'm wondering, and I know the minister may have alluded to this a little bit earlier, but I'm wondering what his government intends to do to help those people.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And, you know, I think the issue of catastrophic drug is one that is very important in a Canadian context, which is one as provincial ministers we have worked quite extensively on developing the Canadian Pharmacare program. I think it's, I can't remember exactly the name of the report now. But ultimately, one of the big parts of that pharmaceutical program is catastrophic drugs. And what we've done really is taken the information that we learned there, and I give a lot of credit to our pharmacy care division, the department, Don Frail, who has been working on the catastrophic drug working group for that pharmaceutical strategy, the national pharmaceutical strategy, and ultimately taking the information that she's had there and try to build it into the model we're looking at for our Nova Scotia PharmaCare program. And basically what we're really trying to do within this model is look at those Nova Scotians who don't have access to a PharmaCare program today. So those are the people that aren't working for a large company. Those who are working for a large company have a private healthcare plan, or the lower income ones who do receive their service through community services. So we're looking at that group in the middle. And what we're really trying to design here will be reminiscent of a catastrophic drug program as well. So those folks who are of modest means, or even, you know, of not so bad means. You know, I'm starting to look at the folks that are in sort of that $30,000 range. But if they have some kind of catastrophic disease and require high, you know, and have a high drug cost, that they should have a system that's going to help pick them up. So any drug plan that we're trying to design here will have that catastrophic drug component built right into it. So, you know, we're not talking about both things at the same time. So I think the commitment we have this year is through that $5 million to have the setup of our program, and in my hopes is to be helping Nova Scotians in that first quarter of 2008.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. Well, Mr. Chair, Mr. Minister, we all know, I guess, when we talk about the issue of catastrophic drugs or many of the other issues that surround healthcare in this province, we talk about, it's easy for us to sit here and say, why can't you provide the funding? Why can't we have the money? We all know that we are approaching, if we're not there already, then we're fast approaching what you would consider to be a non-sustainable healthcare system. If you're going for 50% of the provincial budget, then you're getting there pretty quickly. And if you're going up at 8% or whatever the case may be every year, and looking at a budget of, what is it, $2.9 billion that we'll be looking at this year, you know that you can't sustain that kind of spending much longer. So I know we've broached this topic before many times, Mr. Minister, and we know, you know, it's I've stood in my place in the legislature many times before and said that back in 1999, the then Premier of the province, Dr. Ham, said that healthcare didn't need any more money, it just needed better planning. Better planning was what was required. Well, if you look at us now, you can say that maybe, you know, I guess you could make an argument. Have we had the planning? You can make the argument that costs are spiraling out of control. You can make the argument, you can make a number of arguments. But anyway, in the fall of last year, the government introduced legislation that would protect the public health care system, for the protection of the public health care system. And some people saw that legislation as opening the door to private legislation. The minister will remember the debates that took place afterwards and the interviews and so on. So I'd ask the minister now and give him the opportunity to respond to that accusation that was made, and ask him, how does he respond to that? Was that the case? Has that been the case? And with that legislation that was introduced, what has been done to date and where does it stand at this moment?
Thank you. The Minister of Health.
Thank you very much, Mr. Chair. And you know, the member opposite brings up a number of good topics that we could speak to for quite a long time. You know, let's talk a little bit about healthcare growth for the first couple minutes here I'm going to speak. And healthcare growth has been one that is a Canadian phenomena, if not a worldwide phenomena, on the growth of healthcare. And it has a lot to do with utilization. One, as our population gets older, we're seeing more and more complex cases. And as a matter of fact, we're seeing people come back for you know, second or third treatments of whatever ails them. I think back in 1999 to the credit of that premier. You know, he looked at a system that was having difficulty. He was looking at a system that, you know, had seen a number of reductions over the last few years, and you know, was trying to find ways in order to organize it better, to be able to have a reporting system that worked. And I think, you know, we've been challenged in trying to find that reporting system that we, as the department, can really have a good feeling on what's happening in the system, how expenditures are happening, you know, where the funding is going, and you know, I think that can be, you know, by seeing where those funds are going, it can be indicative of the services that are being provided. So we didn't have necessarily a good way of evaluating the system as it stood, and plus what we did back in 1999 was take that regional system and create a few more district health authorities and basically change the system quite drastically from what it had been prior to 1999. So we really had no base that I can see, the base to evaluate the system on. So I think through FAZOR now, through our facilities review, that we're starting to build a model and know what our numbers are and where the expenditures are happening, and to see how our healthcare teams are working, and maybe look at what they're doing and seeing how they're being effective or not effective. And I think from that information, we're going to be able to really produce a strategy that will ensure that we have the best patient care possible with the dollars available to us. $2.9 billion is still a number that I have trouble with. There are too many zeros in that, and it's really hard to envision how many dollars that really is. And I don't think Nova Scotians really can have the complete understanding of how large that is. I mean, when you put it in a broader, in a simpler context, you know, it still doesn't make sense, because it's, you know, $88 a second, or how much an hour, Alan? I forget. We sort of made that. It's like 300,000 some odd dollars an hour or something silly like that. No, that's a anyway. Ultimately, they're huge numbers that we continue to deal with, and we have invested, and we will continue to invest in this healthcare system. You know, we have done up to almost 9% a couple of years ago. We did 8% last year, and did it get us? And sort of the question we got asked: did it get us better healthcare? I can't categorically say that it got us better healthcare. It sustained the system as it stood today, and people still receive the services that they required. They might have had to wait a little longer, but you know, the systems were there, and the emergency system was there in place. So what we really need to do is have a good feeling of where our base is, and making sure that we're funding DHAs and services appropriately. But we can't fund everything, which is, I think, the other component here, is that healthcare has evolved dramatically over the last 30 years of what healthcare is. I mean, I know the member from Glace Bay mentioned the good old days, and it's hard to go back to the good old days, and I don't think we will ever be able to. But back in the 70s, let's say, back in the 60s, you know, healthcare model was a fair amount different. And, you know, it did have physicians in it. And I will bring physicians up in my discussions quite often, is that I think the physicians are victims of their own success, where Nova Scotians and Canadians felt that they had to go to physicians for everything that ailed them. And I think that's where we've got a little bit into our problems. I had a really good thought there, and I kind of lost it. But ultimately, building up to, I know the member opposite sort of tries to put a correlation between all those things that are going on in the growth of healthcare to the Licensing Act, or Bill 126, on how that will save us money. And I don't think we envision, keep that up for a sec, that'll envision that will help us save money in the healthcare system. I think what we need to do is, I don't think we're going to find huge savings in the healthcare system. What we need to continue to do is ensure that we have means to provide the services that Nova Scotians expect. So I think that's how that will build into that equation. But if we look at the cost, and it's more than the acute care system. The costs have gone up in home care, in long-term care, and also in pharmaceuticals. And you know, I think it's going to be a challenge to find the balance between those. But I think we've got a lot of good work going on that will help us provide that base to know where we can go into the future.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. The minister raises some excellent point, an excellent point as to whether or not, if you continue to fund healthcare at the pace that you're doing it now, but are you really getting your money's worth? Are you really getting better healthcare in this province? And I think a lot of people I would think today are wondering about whether or not, with that much money going into healthcare, they're worried not only where the money is coming from, but they're worried about whether indeed the healthcare itself is going to be there. And how can we actually do that? How can we afford to continue at that pace? And I'll tell you, I know in my riding anyway, that and the minister would probably know the same from across the province, it's a real worry. Some people are very, very concerned of the fact that this province is headed in that direction, where we're approaching 50% of our budget going towards health care. And our left scratch, not everyone, you know, you don't have all the answers. I understand that, Mr. Minister, nor would your staff. But I guess most people are concerned, and I'm one of them, that are worried about if we're going down that road of wondering what can we do, then exactly where is that road leading us, and where is it going to end up? And I think that's where the debate ended last year at this time, and that's when the questions started being raised, and that's when the legislation came about. But I'd be interested in knowing, perhaps you can explain to us, that it would be extremely important that the stakeholders in healthcare are being consulted at this point. And how much are they being consulted, and how much input will they have towards perhaps a final solution?
Thank you. The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And you know, I alluded to it a little bit in my last answer, when it really, you know, we have to really design a system that is responsible to the needs of Nova Scotians. But we really have to have a better understanding of what is expected by Nova Scotians. You know, we keep, from a managerial standpoint, from a DHA standpoint, is that programs keep coming to us because we have this subset of the population that wants this kind of service, and we try to be everything to everyone. And I think what we really need to do is continue to help out as best we can on that side, but also invest some money in primary health care, in wellness, and what we're trying to do through the office, or through the department now of health promotion and protection. It is only recently that we've had mechanisms in place to really analyze health outcomes, to know you know, what that patient outcome is going to be, what Nova Scotians or what the patients expect. And you know, it's only through that kind of base knowledge that we can affect any change in the future. If we look at that growth, you know, which is somewhat inflationary, which is somewhat trying to respond to needs that are brought forward, you know, it doesn't match up with the growth of our provincial revenues. And I think this year what we've really tried to do is make some money available within the system, and I mean the provincial system, that money can be available to departments like HPP so that they can invest in rinks, in sport facilities, and those kinds of things that really helps out our communities in being healthier. And I think it's only after that societal change that we're going to see any real change in the cost of delivering our acute care system. And I don't know really how to affect societal change. And all I know at this point, it's going to take us a lot of time.
Thank you. The honourable member for Glace Bay has approximately 9 minutes left.
Thank you, Mr. Chair, and I agree, Mr. Minister. I don't know how we come about that in a compact period of time either. I have no idea. But in the meantime, what you're left as the situation is just, you know, straining. What you're left with is, for instance, you're left with in Inverness right now, there are no obstetric services that are available right now. And You know, some people are forced to travel a couple of hours in either direction to obtain obstetrical services. And in other areas, you have ERs that are closed for a period of time. All of these issues that we've already gone over the past several hours. So I don't know what, but I do know that what's required is some sort of vision that has to be there on behalf of government. I'm not saying wake up tomorrow, Mr. Minister, and have the cure for health care in this province, but that vision has to be there, agreed, granted, over a long period of time. That vision has to be there so that finally, at the end of the day, you can see some light at the end of the tunnel. You can say that, you know, in 5 years, in 10 years, and whatever the case may be, we're going to reach that goal of finally coming to terms with health care in this province and perhaps even reducing the overall costs of health care. No matter, and I'm sure the average Nova Scotian will agree, no matter how you obtain that in terms of if we're going to start along the lines of health promotion or whatever, most Nova Scotians will agree we can all do better at that and we can all contribute more. But at the same time, I think that every Nova Scotian would agree that public health care has to stay exactly as it is and has to be offered to every Nova Scotian without hesitation. That has to remain as part of your vision on behalf of this government. So I know we don't have much time left, and there are a number of other questions that I could ask according to some line items that I have. I'll save that for another day. But I just wanted the minister's thought on perhaps where you see that and what you see as your government's vision, so to speak, of where we're going to be in the next 5 years and the next 10 years in terms of health care, the overall budget, in terms of what we're offering everyday Nova Scotians in health care for them, what it means to them and what it means to the minister.
Thank you. The Honourable, the Minister of Health.
Thank you very much. Thank you very much, Mr. Chair, and through you to the member opposite. You know, I think the challenge has been up to now is that we can look at our expenditures on a year-over-year basis and see the numbers, the money we're spending. But we really haven't had the opportunity to look at what our service delivery is, where exactly all those dollars are going, and be able to have a base so that we can build that vision for the future. And I think what we've been doing through FSOR and I'm really hoping that the information that we provided through them will really give us that base to measure what those outcomes are and really give us some ideas on how to provide better provincial services with a respect for the regional differences. And, you know, and I think over the next number of years, we'll continue to invest in primary health care, you know, working with our wellness programs, continue to invest more money over at health promotion and protection to ensure that we have better opportunities in communities. And not only does that help us be healthier, but it's also an attraction tool for physicians and other practitioners that we might want in Canada. The other thing that has to happen, I think, congruently, is that the Canadian healthcare system has to sort of evolve and change with us. Because if we're doing our changes here and trying to reform healthcare, and it's not happening in either Prince Edward Island or New Brunswick or Ontario, people will look at the way we're doing things and compare it to how they're doing things, and you know, it'll just get all wonky. So we have to work, there's a good word for you tonight, wonky. We need to continue to work with our provincial and territorial colleagues on further reform. You know, we have to continue mental health reform. We have to continue pharmaceutical reforms. You know, there's so many things that all have to work together in order to affect true change to our healthcare system. And I'll conclude just quickly here as well. You know, I was talking about our cost in healthcare and trying to put, you know, a better mind to the expenditures in healthcare. You know, 2.8 billion. You know, it's a 2.8 with lots of zeros, or with a billion word after it, with a B, and you know, and I'll try to draw this explanation out as best I can. Is that, you know, $2.8 billion in context, of course, is 48% or 49% of our total budget, and you know, if we don't do anything that addresses this. It will be 50%, it'll be 51%, it'll be 52%, and it'll continue to grow until the Minister of Health, the Department of Health, will be the only minister or department of government. You know, and as much as and I don't think I'd like that, because then all the decisions would fall on that poor Minister of Health. But ultimately, if we don't make some changes in the short term and get a really feeling where we are, and to make those changes in the short term, you know, and I need to look to the Minister of Energy, you know, of what his department would be, or what we would be without his department, where we would be without a Department of Agriculture or a Department of Fisheries and those kinds of resources. Because really what we're a Department of Justice. I know the Minister of Justice sometimes would feel it, anyway, like to take it on, but ultimately, you know, without further funding from other sources, whether it be from the federal government or whether it be shutting down some of our baseline departments, you know, we're not going to be able to address the health needs as it goes forward. So we do need to effect some of that change and get it to a point where it's manageable, or at least consistent with our provincial growth. Which is why this year we took the different approach of trying to cap that growth, of trying to say, listen, we'll strategically invest into the places that we know are going to have some effect on the bottom line. But we're also going to cap some of these things. We're going to say that growth is not about a whole bunch of new programs. That growth is about the natural progression of existing programs, so status quo pressures. And I think what we're going to try to do as well is continue to invest to the health indicators. You know, what's education and how that works. You know, what the environment is doing to the health of Nova Scotians, what income is doing to the health of Nova Scotians, and focus in on those sides of it rather than the acute care piece of really investing money on that side. Because I continue to think that, you know, the more I look at it, it's sort of this bottomless pit that you just keep throwing money at, and it doesn't necessarily give you a healthier population or what. It does address the issue, but it really, where does that get us? And I think as a minister, I need to step back a little bit sometimes, is look at how that system is responding, what are those outcomes, and try to address maybe some of those income issues, making sure that they have the means for them, and those kinds of things. And I don't know how much time I have left before, well, basically I'm going to end it this way, and I look forward to some questions at a future day, is that we spend, like I said, $88 a minute or so. We're spending $5,629 a minute. We spend $338,000 an hour, and in the course of questioning over this last 4 hours, the healthcare system would have spent $1.3 million of taxpayers' money. So it's an issue that we have to and must address over the short term and well into the long term. Thank you very much.
Thank you. The time allotted for debate in Committee on Supply has now expired. The Deputy Government House Leader.
Thank you, Mr. Chair. At this time, the committee do now rise and report progress and beg leave to sit again on a future day.
Thank you. Order, please.
The committee, the whole House on Supply reports. The committee has made progress and begs leave to sit again.
Thank you. The Honourable the Deputy Government House Leader.
Thank you, Mr. Speaker. I'd like to call public bills for second reading.
Public bills for second reading.
To call Bill 145, Education Act.
Bill number 145, the Education Act. The honourable member from Halifax Needham.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm pleased to have an opportunity to continue in the debate on Bill 145. When we were last discussing this bill last week, I had an opportunity just to make some brief opening remarks, and I wouldn't mind reviewing those so I can sort of get back to my train of thought, Mr. Speaker. And I was saying that I have had I think, the misfortune in many respects to have had a school review process under the old rules in my constituency some 4 or 5 years ago. And at that time, certainly the process was one that did not seem to have a clear set of criteria in terms of making really important decisions about the future of small community schools. And I did have an opportunity to appear in front of the 2 individuals that the minister had appointed to hold public consultations on the school closure process, Ms. Kennedy and Mr. McDougall. And during that presentation, I did have an opportunity to speak with them about the experience from North End Halifax perspective. And as I was saying last week, I not only felt listened to by the consultation personnel, but I also felt heard by them. And so I welcome the measures that are being brought forward in this bill. Now, I particularly welcome them not only, though, because of that experience, and the minister will know, I wrote her, along with the former school board member from my area back in December, I wrote her regarding the plan of the Halifax Regional School Board to amalgamate, consolidate a number of elementary and junior high schools on the peninsula of Halifax in the north and central part of this community that I represent. And Kim Burkers, who was the school board member at that time, and I want to say, Mr. Speaker, a school board member that did a very admirable job on behalf of the schools in my community prior to the suspension of that board. Ms. Burkers and I jointly wrote the Minister of Education asking that she not move forward with approval for the replacing of new schools, or replacing of the small elementary and junior high schools in our area until there had been adequate public consultation. And Mr. Speaker, you will be no doubt aware that under the Education Act as it currently exists, there is no requirement for a school board to hold any kind of a public review when it's consolidating or amalgamating schools. It's merely when a decision has been made to close a school that there is any requirement. And Mr. Speaker, the Halifax Regional School Board had submitted to the Minister of Education a very large laundry list of schools that it intended to consolidate and replace with quite an orgy of capital expenditure for new schools on the peninsula, starting with the the schools in my colleague's constituency, the honourable member from Halifax Citadel, and then proceeding to amalgamate schools in my constituency. And the plan, Mr. Speaker, was to close Highland Park Junior High and Oxford Junior High and St. Pat's Alexandra Junior High, and open a new junior high in 2012, and additionally to replace a number of elementary schools, Oxford Street Elementary, St. Stephen's Elementary, part of St. Jose McKay, and open a new elementary school in 2013, and then an additional elementary school in 2013 that would also take into its new boundaries, St. Pat's Alexandra. Now, Mr. Speaker, in discussing this plan with people in my community, there were various reactions. The first reaction, of course, was that the community were shocked. They had never had any information whatsoever that this was being contemplated by the school board. And Mr. Speaker, I would be happy to table a copy of the MLA report that I sent into the constituency in early January, where in fact I provided this information to constituents that I represent. And I have to say, I have never had a response from my community to anything else that I have sent out to them like this. People were really concerned about what they were learning for the first time. And the phones in my office were busy, and people were stopping me in the parking lot, and they were stopping me even if I went to the grocery store. And people wanted to talk about this, and not only people who had children in those schools, but the broader community wanted to talk about this. I had a gentleman who is a fireman with the firefighter with the Halifax Regional Fire Department, whose children have long been finished from the local schools, but who is a very outstanding member of our community, call and talk to me about his concerns. I had a former CBC assignment editor who lives in my constituency call me and discuss at length his concerns about this. And Mr. Speaker, one of the things that is very much on the minds of people in the constituency I represent is not only questions around the quality of education, which, you know, are pretty much primary concerns for people when they hear that smaller community-based schools are going to be eliminated and replaced with big box schools, but people are questioning the financial the financial sense of moving in this direction. The schools in question, Mr. Speaker, are structurally sound. They're not schools that are sick schools. They are schools, many of these schools have been in the north end of Halifax for a significant period of time. St. Joseph's A. McKay School, for example, is a school that was built shortly after the Halifax explosion. And although schools like this have not been maybe maintained to the level that we would like, much of the maintenance that's required is cosmetic. It's not structural. And people in the community are increasingly becoming concerned about the soundness of taking perfectly good structural settings, like buildings like St. Jose McKay, and demolishing these buildings and replacing them with new buildings built at today's prices and they question whether or not this is sound planning on the part of the government. And you have to wonder about that, Mr. Speaker. The Shambhala School, which is in the north end of Halifax on the corner of Russell and Gottingen Street, is actually in a former Halifax School Board property. And it is a beautiful facility. It's a facility that has been there for quite a number of years. The school board got rid of it a number of years ago, and it sat without the kinds of necessary repairs. But Shambhala have moved their school in there, and they have invested in the building, and they have brought it back to the kind of physical presence in that community that is very, very striking. It's a beautiful school inside and out, and people are asking, what are we thinking when we go on these huge capital campaigns of erecting these new buildings? We take perfectly good structures, we demolish them, we send them off to landfill sites that already are overtaxed and can't handle the kind of construction and industrial waste that's being generated. There has to be a better program, and there has to be a better system. Now, Mr. Speaker, I'm not convinced that that the Department of Education, with this bill, actually has a plan in hand that they will, in fact, use that kind of thinking when they look at amalgamation and consolidations of schools. But I would urge the minister that it's not good enough for a regional school board to simply submit a laundry list of all of the buildings that it would like to eliminate and have replaced with new construction without holding that board to some account for buildings that are currently in the system, that are structurally sound, that are perfectly capable of being refurbished to a kind of standard that we would all like to see our children in and like to see in our communities. And so, Mr. Speaker, this is something that I will continue to raise with the minister, and certainly will be watching for as this act takes force, and perhaps the Halifax Regional School Board continues with their plans to consolidate and amalgamate schools. Now, Mr. Speaker, I want to go back to the letter I wrote to the minister with Ms. Burkers, the former school board member. We wrote the minister in December of last year, asking that there be public consultation before any schools in Central and North End Halifax are amalgamated. There is a strong will on the part of the community that in fact be the process that is adopted, that the community have an opportunity to be involved in this process. And I trust that this bill, once it's through this legislature, will ensure, in fact, that will occur. After I sent my newsletter around with the information to people in my riding, I embarked on a process of meeting with the school advisory committees for each of the schools. And it's a very good process to go through, and I would recommend it to any of the members of this legislature who haven't had an opportunity to meet with the school advisory committees, because the school advisory committees are made up of parents whose children attend the school, the administration and some of the teachers in the school, and often people from the community who have an interest in the school, but also in the broader community, and ensuring that the one group supports the other group.
Order, please. Too much chatter in the chamber. The honourable member for Halifax Needham has the floor.
Thank you, Mr. Speaker. So in this process, I was able to meet with most of the school advisory committees for the various schools in my constituency. And I want to say, Mr. Speaker, how impressed I am by both the principals and the teaching staff and the parents and community members who dedicate their time to school advisory committees. People like Doug McDonald from Ward 5. Ward 5 is a community-based institution in the north end of Halifax. It's not an institution. Doug McDonald is an institution. He'd probably kill me if he could hear me say this. But, you know, it's a community-based organization that provides security and support to families, to seniors, to children, to adolescents. There's a food bank, a hot lunch program, lots of recreational opportunities, and just a really sound and sympathetic ear quite often at the Ward 5 Community Center from Doug and his staff for members of the community that they serve. And there is Mr. McDonald serving on 2 school advisory committees, Highland Park and St. Joe's A. McKay, and where he finds time to do this, given all of the other commitments that he has in his life is beyond me. But it's people like Doug McDonald who make our community strong, but more importantly, make sure that the communication between the community and between the schools are functioning like they should. Now, Mr. Speaker, one of the other things I would want to say about what I've learned around the school review process and the school closure process is the fact that while the Minister of Education continues to give the appearance of being at arm's length from this process, and in fact I noted that the Minister talked about how this Act provides no role for the Minister following the review process and recommendations, and no appeal to the Minister, I want to say that I, like many members of my community, have a bit of skepticism around this particular situation. It's been told to us now on too many occasions around school reviews that in fact what's driving the school review process is the Department of Education, is the Minister of Education, is senior officials in the Department of Education, and in fact it is not a scenario that's initiated at the school board level. And with respect to the closing and the proposal to amalgamate and close or consolidate so many of the small schools here on the peninsula, we have been given to understand that those directions to the Halifax Regional School Board have in fact come from the very highest levels of the Department of Education. And therefore, Mr. Speaker, I think that at some point it would be really good to hear from the Minister, in fact, whether or not this is the case, whether or not there is a desire in the Department of Education to see a reduction in the number of small schools on the peninsula of Halifax, serving local communities, serving small neighborhoods, and whether or not there is this kind of desire to move toward bigger, as my colleague from Halifax Citadel says, big box schools. Because if that's the vision of the Department of Education and the Minister of Education, then, Mr. Speaker, it would be a good thing for people to come clean and say that openly and not hide behind, hide behind the school board, Mr. Speaker, and make school boards the scapegoat for school review processes. Mr. Speaker, the last thing I would say before I take my seat is that while this bill is very welcome in that it adopts the recommendations of through the consultation process, it will be looking at having some standardized criteria and some clear criteria. I'm not sure that all of the possibilities for what need to be examined are in fact going to be a part of the process. We won't know that until we see the regulations that accompany this particular amendment to the Education Act, and in fact how this process will actually work. We won't know until we actually give it a test drive, Mr. Speaker. But having said that, the fact that we're moving away from what was clearly an inadequate and a poorly executed school closure policy under the old Act is a very good thing. And I sincerely hope that we can make this new process work to the benefit of parents and students and to the benefit of communities, the rural communities, but also the neighborhoods, including the old established neighborhoods in our urban settings, such as the old established urban neighborhood of North End Halifax that I'm very proud to represent. And I think the people in this constituency and this part of our province deserve a process that has as much integrity and good common sense as any other part of the province of Nova Scotia, Mr. Speaker. And so with those words, I will now take my place. Thank you.
The honourable member for Hants East.
And I'll be brief, or try to be brief. I want to get to kind of the core of my reservations, I guess, with this legislation. I guess if the adage, the proof is in the pudding, I guess we have to take this legislation for a trial run and see how it works. The fact that there's a process, and perhaps I'm hoping, although it's not entirely clear to me, and how much of that is my fault, in the interpretation of this act and the comments made, I think, from the minister's press statement. But I want to say, Mr. Speaker, if it works, I'd be very pleased to be endorsing that. Back in 1998, I was a fairly freshly minted MLA, and one of the first meetings I went to actually was around the closure of a school in my village in Enfield, and actually the community was of the impression that they were getting a new elementary school, and actually that was the statement made by the department. And when I questioned the deputy minister at the time, which was Lloyd Gillis, He confirmed for me that I was right, that there was a new school to replace the Enfield District School and the old E.H. Horn School. The local councillor actually invited me to a meeting held by the board around this project, and when I got there, I was surprised at some of the people at this meeting because they weren't connected, as far as I could tell, to that community and the school. And what I walked in on was a meeting that actually, according to this person working for the school board, was a meeting to build a grades 3 to 5 school for both Enfield and Elmsdale, and no one in my community was aware of that. And what I was told at that meeting was that this was a private meeting and nothing from this meeting could go out to the public. At which point I indicated that I was the MLA, elected by the people, and there was nothing going to be private about my comments in this regard. Now, I would think that the school boards might be a bit iffy about this legislation. In other words, it may rein them in a bit. And I guess my reservations are such that the process that we previously had, or presently have, I guess because this bill is not law yet, that we presently had, really should have been enough to address the issues raised by communities, but communities didn't get an opportunity to raise their issues. Matter of fact, from what I could see, there's the steamroller was picking up steam, or maybe I should say locomotive, was picking up steam, and the communities really weren't always very aware of what was going on until the final minute. And I have that same reservation in this process where, you know, by regulation, the board identifies the school for the review. It does that by certain criteria. Then there is a report a committee put together to do a report, and then when this committee's report is examined, the school board will hold a public meeting. So we're going to have a public meeting well down the road in this process, and that is a part of this that I have a problem with. I would like to see the public involved at a much earlier stage in this process rather than this far along in the process, and that causes me some reservations. I was looking at the recommendations, and which I understand are going to become part of the regulation or considered in the regulations. And one of them is, I guess the first one is the removal of the word closure from references to the process. And then when we get to recommendation number 6, requires the principal of schools affected by a closure to jointly develop transition strategy for affected students. But there's nothing about transition strategies for any other options that might happen. If we stick with the status quo, will there be anything done? If we consolidate schools, will there be a transition strategy? It doesn't indicate that. The only one would be the permanent close of a public school. That one has a transition strategy. So I would like to think there's going to be a strategy developed around any of these options, not just the closure option, which is the word that's being removed from the process. I'd also, when we talk about developing regulations to recognize mitigating factors that should be considered in a school review, these include but are not limited to, and I guess not limited to would mean there's room for what I'm thinking, but transportation issues, projected economic growth and geographic isolation. Well, certainly student numbers and programs, I think, would be two things that we would want to consider in this process. And something from being a teacher, I would like to know that before we ever get down this road, that, that the board actually has a process to try to mitigate against going down this road, that we have some things in place, and this could require input from other departments as well, but, you know, what's going to happen in terms of, you know, per capita funding. You know, we give boards based on the number of students that they have, so many dollars. You know, this affects programming and number of teachers you can hire, et cetera, et cetera. And there should be policy in place that looks at if your student numbers drop, you fund a program. You don't just fund on a per capita basis, and you don't withdraw students after, or withdraw teachers after a certain number of students. You still fund a program that, you know, if you drop from 24 to 18, you know, you still offer a program and fund the program, not just the number of students. So I guess my reservation is around how this act came to the House, or how this moratorium came to the province, I guess, is what I should be saying. You know, we were coming fast on the heels of an election, Mr. Speaker, and